Alright, so in trying to manage pain in the pelvis, it could be due to trauma, it could be that the woman has given birth and all of that. There's things we use. One of it is what? Pelvic binders, something to hold your pelvis together. Alright, several reasons could make somebody want to opt in for this. Alright, then also angiographic embolization. I know angiographic embolization is like you are trying to pass in something to basically stop bleeding. Okay, so first of all, you should just know that there are critical interventions if you want to manage pelvic fractures with hemorrhage, especially in trauma settings. Okay, then pelvic binders are also employed in women that are giving birth. Yes. Okay, but here is orthopedic, so let's talk about trauma stuff. So they serve different purposes. They are often used complementary depending on the patient's condition. You might use one, you might want to use the two. So pelvic binders, this is it. They stabilize the pelvic ring. They reduce bleeding by compressing the fractured bones together. Do you understand? Keep the bones together till they heal up. All right. It's applied in early trauma care, especially in pre-hospital emergency settings. Advantages is quick, non-invasive, helps to control venous bleeding, bone bleeding. All right. Facilitate transport and initial resuscitation. So limitation is not really effective for arterial bleeding. May need to be removed before angiographic access. Okay. The angiographic embolization targets and blocks any blood vessel that is leaking. Okay, all right, you block it. Okay, so it's performed in interventional radiology suits once the patient is stable enough. Advantages is effective for stopping bleeding in the arteries. All right, and can be selective, unlike the pelvic binders where you are binding everything including what is injured and what is not injured. This one, you are targeting the artery that is bleeding the most. So limitation: cannot be used for venous bleeding, cannot be used for artery bleeding. Also required people that are very skilled. You understand? So risk of complications like ischemia. All right. So combined approach. Often pelvic binders are applied first. After the patient is stabilized, they use angiographic embolization. Do you understand? So that's just what these two concepts mean, in case you have been wondering what they actually mean, and basically their involvement in treatment.